Today I want to talk about a commonly prescribed topical antibiotic called Mupirocin. We'll cover what it's used for, potential side effects, drug interactions, who should avoid using it, and some special considerations. My name is Pharmacist Michael, your go-to source for health and wellness tips. As a board-certified clinical pharmacist in pharmacotherapy and psychiatry, I am here to help you live a happy, healthy life. Mupirocin is a topical antibiotic that's primarily used to treat bacterial skin infections. It works by inhibiting the growth of bacteria on the skin, making it especially effective against certain strains of Staphylococcus and Streptococcus bacteria. It's most commonly prescribed in ointment or cream form, and is usually applied directly to the affected area of the skin. Mupirocin is primarily used to treat minor skin infections such as Impetigo, which is a highly contagious bacterial skin infection that often affects children. It presents as red sores or blisters, typically around the nose and mouth, and Mupirocin is very effective in clearing it up. In addition to Impetigo, Mupirocin is also used for treating folliculitis, which is an infection of the hair follicle, and small wounds or abrasions that have become infected. Another important use is the eradication of nasal colonization of methicillin-resistant Staphylococcus aureus, or MRSA. In this case, Mupirocin nasal ointment is applied inside the nostrils to reduce the risk of spreading MRSA to others or developing serious infections. While Mupirocin is generally well tolerated, like all medications, it can cause side effects. The most common ones include mild burning, stinging, or itching at the application site. These symptoms are usually temporary and go away as your skin adjusts to the medication. But in rare cases, Mupirocin can cause more serious side effects. These can include severe allergic reactions, such as rash, itching, swelling, or difficulty breathing. If you experience any of these symptoms, it's important to stop using the medication and seek medical attention right away. Mupirocin typically has minimal drug interactions because it's applied topically rather than taken orally. However, you should avoid using it with other skin products such as strong topical steroids or other antibiotics, unless directed by your healthcare provider. Mixing too many different treatments on the same area of the skin can increase irritation or affect how well the Mupirocin works. Mupirocin is generally safe for most people, but there are some situations where it might not be the best option. For example, those with known allergies to Mupirocin or any of the ointment's ingredients should avoid using it. Additionally, Mupirocin is not meant for larger deep wounds like severe burns or surgical injury, unless specifically instructed by your doctor. It's also not suitable for use in the eyes. So if you're dealing with any kind of eye infection, this isn't the right medication. Here are a few things to keep in mind while using Mupirocin. Follow your doctor's instructions carefully. It's important to use Mupirocin exactly as prescribed, typically 2 to 3 times a day for a specific number of days. Don't use it longer than prescribed, as overuse of antibiotics can contribute to bacterial resistance. Don't apply to large areas. Mupirocin was intended for small, localized skin infections. If you have a large area of infected skin, you should consult with your doctor for a more appropriate treatment for it. Don't use Mupirocin unnecessarily. This is an antibiotic, and using it when it's not needed, like for a fungal or viral infection, can promote resistance, making future bacterial infections harder to treat. If you're pregnant or breastfeeding, consult with your healthcare provider before using Mupirocin to ensure it's safe for you and for the baby. So that's the lowdown on Mupirocin. It's a highly effective treatment for certain bacterial skin infections. But like all medications, it needs to be used correctly and under the guidance of your healthcare provider. If you have any questions or concerns, drop them in the comments below. or reach out to your healthcare professional. Thanks for watching, and don't forget to like, subscribe, and hit that notification bell for more health-related content. Until next time, stay healthy and stay informed. My name is Pharmacist Michael. Be happy and be healthy.